Did you know there's a difference between Medicare and Medicaid? Hi, my name is Jen Denorio. I'm an attorney with Lulich Attorneys. Medicare is a health insurance that people over the age of 65 receive. Medicaid, on the other hand, is a public benefit that is given to those who are medically needy and meet an asset and income test. Medicaid is important for everyone to learn about, getting ready for those stages of your life where you may need long-term care planning. Whether that be in an assisted living, a nursing home, or care at home, Medicaid will cover some of those costs if you qualify. However, there is some hard limitations to Medicaid in order for you to qualify, which we will get into. But first, everyone should be made aware of that long-term care, especially in Florida, is extremely expensive. Right now, an assisted living can cost anywhere from $6,000 to $10,000 a month, and a nursing home can run you anywhere from $10,000 to $15,000 a month. So it is extremely expensive. And what most people wonder is, how are they going to pay for this, right? Not a lot of people have that many assets, and if you do, that's still a lot of money that could potentially be used up very quickly. So there are several ways to pay for long-term care. One, and the first obvious way to pay, is privately pay. You know, just paying with your own assets, and as you use them, you use them. But obviously no one really wants to do that. Second option, and my personal favorite, is a long-term care policy. This is the best option because they will cover up a certain amount of years or a certain amount of money that you spend at a long-term care facility. So I would highly suggest everyone look into this. It can be costly, and it normally gets more expensive the older you get, and it can be hard to qualify, but it is really beneficial. There are even some long-term care policies that turn into life insurance policies if you don't use it. So it can still benefit your family in the long run. The third way to pay for long-term care is using Medicaid. Okay, so with Medicaid, first you have to meet an asset income test. For income, you have to be below $2,800, about $2,800 per month, and your assets have to be below $2,000 the day you apply. The month you apply, you have to show one day you were under $2,000 in assets, which may seem crazy, and I know a lot of you are probably like, there's no way. But there are a lot of tools that are provided here in Florida that can allow us to plan in order for you to qualify. On top of the asset income test, you also have to be medically needy. They have a scale where you are placed on that. Now, with planning, there are a lot of tools. Specifically, though, we call it advanced planning versus crisis planning. Crisis planning is mom's going into an assisted living next month. She needs, someone to help pay the bills. That's crisis. Advanced planning are those who, maybe 10 years from now, they think they might be in a position where they need long-term care. It is way easier to plan in advance than the month before. So I highly suggest everyone to look into what it takes to be prepared for this, because it will come. Unfortunately, long-term care is needed every day, especially in Florida with our elder community. So it is good to be made aware of what planning may be needed in the future.